For the aging phase, there's two components. There is the descendance of the tissue, where the tissue fall down at the effect of the gravity. Also, there is the volume loss. And that's usually at the expense of the fat, but also the bone and potentially the muscle. To correct that or to improve the rejuvenation of the face, we have to lift and also volumize. The volumization is often happen via fat transfer, so we borrow some fat from the thigh or the abdomen, and we add it to some areas that we think it's hollow, especially around the temple area, and to the mid-face, to the malar area, and around the pre-jaw sulcus. And there are three malar fat pads, medial, middle, and lateral. Those fat pads descends down with the gravity. And the way we address that is by lifting the face, lifting those fat pads in the deep plane after releasing them from the deeper structure. And we lift them without any tension to the appropriate location in the mid-face and under the eyes. So what are the other factors that are often neglected? Factor number one is the deep volume underneath the platysma muscle. We have two platysma muscles, and these muscles get weaker with age. But even in younger patients, sometimes there are fat storage underneath those muscles. And decreasing that volume in specific patients will improve the shape and the angulation of the cervical mental angle. Sometimes there's bulky digastric muscles, there is descendant or enlarged submandibular gland. Reducing that volume by itself will improve the shape and the angulation of the neck. In certain people, the platysma muscle is short, causing tenting and obliqueness in the cervical mental angulation. In addition to that, the hyoid bone, which is a bone that a lot of neck muscles insert to, could be low in some patients, causing obliqueness in the angulation. And we were able to elevate that hyoid bone by elevating the platysma muscle vertically, by doing platysmoplasty, bringing the muscle together in the midline, and also elevating the muscle that's been loose laterally behind the ear into the mastoid bone. So what we do usually, we create a small tiny incision behind the ear, invisible in younger patients, and we access the muscle, release it from parotid fascia, and we elevate it vertically behind the ear into the mastoid bone. We elevate the muscle to a higher ceiling, will improve the shape and the angulation of the neck. So overall, tightening the muscle, elevating the fat pad, decreasing the volume in the neck, lifting the platysma vertically, all those will create one unit of the deep plane face and neck lift.